Hi, my name is Morgan Vigil-Hayes, and I'll be presenting our work on designing behavioral mobile health for Native American youth. One of the challenges that our project seeks to address is the fact that Native youth are disproportionately affected by behavioral health disparities. And two of the major reasons for this is just lack of access to behavioral health care resources, often due to rurality, as well as perceived lack of relevance of existing behavioral health care interventions. One of the opportunities that we observed was the increasing prevalence of mobile phone technologies amongst Native youth. And so this project seeks to understand how we might leverage that mobile technology to design more accessible and more relevant behavioral health care resources for Native youth. So to begin exploring these design best practices, we formed a community advisory board of 6 Hopi and Navajo professionals with experience working with Native youth. And based on our interviews and our discussions, we identified 4 key areas that we needed to include in a prototype intervention that included mindfulness learning activities, social awareness activities, reflection activities, and mindfulness practice activities. And we implemented a prototype Android app that focused on implementing all of the activities in the green boxes here. We then demonstrated our prototype app, which we called ARORA, to Native youth that had been recruited from the Flagstaff area and were representative of Native youth ages 12 to 18. So we had 2 focus groups of 5 and 6 individuals respectively. And one of the things that we had them do was test the application software and give us feedback on things that they liked and did not like about the app, as well as use paper and pencil activities to kind of draw in their ideal designs of what an app should look and feel like, which is shown here in this drawing. Some of our key findings were that youth desire explicit didactic elements when engaging with psychoeducational materials and cultural materials. So they wanted to know specifically why different elements of an app were considered to be culturally relevant or good for mental health. There was also a real challenge with scaffolding for a culturally dynamic population that would shift between cultural contexts and also had multiple cultural identities. Our next steps will focus on prototyping with the Hopi tribe through an NSF grant and submitting for larger NSF funding in the fall of this year.